Hello, my name is Mahogany Donaldson. I will be representing Memorial Community Hospital, MCH for short, alongside my colleagues Charlie Gentile and Gabriel Hickson. Memorial Community Hospital is located in Keene, Missouri. Most of you have probably never heard of Keene, but I'm here to tell you we are a proud small community with a population of just over 6,000 people, not including gals. The primary jobs in Keene are in farming and agriculture. If you ask residents why they live and why they love Keene, they would tell you that in the community, we are family-oriented, peaceful, traffic-free, and we have plentiful parks and recreational activities without the high crime rates and high cost of living associated with larger cities. Of course, there are challenges associated with living in Keene, just like any city. In Keene, the challenges we face are in having an aging population, having lower education levels, lower incomes, and less healthy lifestyles. As you expect, this has led to a great need for healthcare services and coverage. Keene also happens to have an issue with seatbelt use, having large numbers of residents who are uninsured and underinsured, and an issue with high incidence of kidney disease and chronic obstructive pulmonary disease, COPD, associated with tobacco use. Memorial Community Hospital works diligently to fight these challenges through a patient-centered healthcare model where we treat patients like family, not numbers. Built in the 1970s, Memorial Community Hospital is one of only 3 base sites for our county, and our mission is to strive to provide and work alongside our patient population to ensure the highest and most personal form of quality care. Using our years of quality clinical experience, we inspire hope and promote well-being for both patients and families. We are a facility with clear values and work hard to provide excellence, ethical practices, autonomy, justice, and integrity, and vision. Today, we are here representing MCH, asking you to consider additional funding for our hospital and to promote more public health initiatives. Next, I will pass it on to Gabriel Hickson as he will speak on our need for funding. Thank you.
As you know, Memorial Community Hospital is based in Keene, Missouri. Keene, Missouri is a small rural town due to its small population size of 6,000 people. And did you know approximately 1/3 of the population in Missouri lives in a rural area, and the other 2/3 live in an urban area such as Kansas City, Springfield, Columbia, or St. Louis. In those rural areas, the communities face more health disparities due to the lack of access to healthcare, travel times, lower social economic status, and more. This causes a higher rate of heart disease, stroke, obesity, and diabetes. Some of the services that we provide at Memorial Community Hospital is home health services, diagnostic testing, laboratory services, hospice care, and therapy services, and emergency care. We ask for extra funding in order to keep these services afloat and to continue providing service to the people in the community. We are dedicated to providing care to the high percentage of governmental and uninsured patients, and we strongly believe in helping the underserved. And if we are unable to have these extra fundings, we may have to have cost cuts, such as reducing the number of our staff. If we reduce the number of our staff, there will be even longer wait times for our patients, which will only continue to add to the health disparities and overall lower the quality of care for our patients. Additionally, we may have to cut out some of our services like hospice care. This is a big deal because our main population in Keene is older adults. Additionally, we would also like to ask for extra funding to tackle the higher rates of chronic obstructive pulmonary disease and kidney disease. In our population, we have noticed that there are higher rates compared to other rural areas, and we would like to be the main organization in order to lower the rate so that our community is healthier, safer, and better.
There are many strengths to our facility here at Memorial Community Hospital. Here in Keene, Missouri, we have the most capable and professional healthcare workers in the state. We are dedicated to providing the highest quality of care to the most vulnerable and compromised patients. We have mandatory vaccinations for all employees with only minimal exceptions for those with compromised immune systems, religious exemptions, and certain allergies. We take the health of both patients and healthcare professionals extremely seriously at Keene. We have a long-standing history for almost 52 years, and we have an experienced and seasoned senior staff, and the quality of our clinical resources are always top tier. We have the most up-to-date diagnostic testing, lab services, hospice care, and therapy services. We are the only established facility for 15 miles and the first of our kind to have a large, capable staff in Keene, Missouri. Our practice is a key factor of the health of our community, and we are a large pillar of our community here in Keene. Our 8 physicians know how to take care of a lot of our patients, and even though we are a small practice now, we are well-rounded and extremely experienced. Our strengths will only be heightened and even more respectable with proper funding. Funding would increase revenue and let us be able to treat our community on a larger, more inclusive scale. Being able to bring care to the people of Keene is always our #1 priority. Our strengths and expertise make us the perfect candidate for funding, and we could revolutionize medicine and access for care in more rural communities using all of our hospital's strengths. The main issue with hospitals today is the money needed to run facilities, and we see time after time again that hospitals can't keep up with certain strict budgets and will close all around the United States. Without proper funding, we are unable to competently share our gifts and medical expertise with our community here in Keene. We are the only people in Keene with the expertise to keep our community safe. Without us, there would be no healthcare access, and there will be a large drop in Keene's health outcomes overall.
At MCH, we try to be as resourceful as possible with our funding that we currently have. We do not solicit charitable donations. We do not put up much money into our fancy facilities, and we do not buy new if we can buy it used. We do not have a $1 million organization that financially supports us. However, we use every dollar that we earn to run our organization properly by providing quality care to our #1 priority, which is our patients. If provided, the funding will not only benefit Memorial Community Hospital, but the residents of Keene, Missouri. We will be able to provide more beds, and we'll be able to offer more services in our acute care, emergency care, in our rural health clinics, and more. We will be even able to hire more physicians, nurse anesthetists, surgeons, and physician assistants as they are needed as more healthcare issues arise. Overall, with this funding, we will be able to achieve our goal and our vision. It is our goal to provide affordable and accessible healthcare to all individuals, regardless of their age, their sex, race, sexual orientation, and socioeconomic status, by providing accessible and efficient healthcare services. In conclusion, Memorial Community Hospital is extremely grateful for this opportunity to speak to you today. We thank you for listening to us